first step is obviously admitting or acknowledging that we have them, that we aren't perfect, that there may be better ways to do what we're doing.
Cincinnati Children's Hospital is an internationally renowned pediatric medical center. Concerned about clinical outcomes for CF patients, the institution has embarked on an ambitious redesign of both inpatient and outpatient services. The hospital has taken the unprecedented step of working directly with parents in an ongoing effort to redesign both the inpatient and outpatient care of their children.
The first step when a patient comes into clinic would be to reassess their nutritional status. And
they rolled up their sleeves. They told us that not only did they support what we were doing in providing their children's health care, but they wanted to help us make it better. I don't think any of us really have that picture of what the perfect health care is going to be like. I think our patients and families have good ideas of what they'd like it to be, and I think they're learning with us.
A little, but I can still feel it.
temporarily.
Empowering families to help redesign medical delivery systems is a major transformation for any healthcare institution. For Cincinnati Children's Hospital, it is the essential first step in the journey to improve the quality of life and increase the lifespan of children with cystic fibrosis.
Having parents participating with us side by side on this project has not only had a tremendous impact on how our quality improvement has played out, it also has had a significant impact in my practice personally. And I think that I've seen similar changes in my colleagues. The changes that I've seen in my practice have been around my comfort level, my ease, and I think in some ways my ability to collaborate with the families of my patients, to work with them as an active partner in taking care of their children's CF. You don't seem like you feel more out of breath than everybody else.
There's definitely been a change in attitude here at Cincinnati Children's Hospital where the patient is really presented with the options for his or her care and is the decision maker. And even a child who's less than 18 often is the decision maker. Now all of this is just an option.
I'm not going to go through
what I went through the first time again.
This is their body. They get to decide what does or doesn't happen to it. I honestly do not feel any threat to my ego or medical degree or experience. I feel that my role has shifted from being the ultimate decision maker to being the provider of information, education, options, and helping them to make the best decision possible. But what they say goes.
Write it down in front.
Patients and families are now more directly involved in making their own care decisions.
Anything else you need today?
But adjusting to this major cultural change has been a challenge for many staff members.
We watch with raw emotion when families talk about an experience that wasn't ideal. And we can not only relate to that in our own personal experiences, but our families tell us the stories. And that's not easy to hear sometimes. But without that, we wouldn't be able to make the changes that we've been able to make.
Keep blowing all the way, go.